A very good morning to one and all. I'm Dr. Somanatha Sharma here to present a poster on a case of self-inflicted ballpoint pen in a male urinary bladder and successful endoscopic management. Self-inflicted foreign bodies in the urinary bladder are extremely rare. They're common in psychiatric patients, elderly patients, children, and also patients who are intoxicated or inebriated. The unusual self-inflicted long foreign bodies in the bladder reported so far are metal rods, wooden sticks, pencil, a clinical thermometer, a toothbrush, and even a fetal bone has been reported. Three instances of pin in the urinary bladder have been reported so far in women. We report a self-inflicted ballpoint pin in a male patient and its successful endoscopic management. A 34-year-old gentleman who was a daily wage laborer with a normal IQ presented to us with the complaints of dysuria, terminal hematuria, and suprapubic pain following self-insertion of an uncapped ballpoint pen into his urethra for sexual gratification. No significant past medical or surgical illness. On examination, his vitals were essentially normal and abdomen was soft. We proceeded with a set of imaging investigations, digital X-ray KUB, USG KUB, and CT KUB all confirmed the presence of a foreign body inside the urinary bladder. So we proceeded with cystoscopy under regional anesthesia. Rigid cystoscopy using 20 French sheath was performed and the pen was visualized inside the bladder. The anterior and posterior urethra was normal and the pen was freely moving inside the bladder once it got filled with the saline. The distal end was free from the bladder wall, but the pointed end of the pen looked like it was penetrating into the bladder wall, but it was just impinging on the bladder wall just above the trigone. So initial attempts with cystoscopic extraction using the cold cup forceps was a failure as the diameter of the pen was greater than the ability of the grasper to hold. So we used a nephroscope, 22 French nephroscope per urethral inserted, and the tip of the pen was held with the help of a tri-prongs, and the pen was meticulously maneuvered out without harming the mucosa of the bladder and urethra and extracted in toto. The total operative time was under 40 minutes without any intraoperative complications, and the post-operative period was uneventful. Follow-up USG and uroflowmetry was normal. So the challenges that we faced, the wide diameter and the plastic nature of the pin made it very difficult for us to grasp and hold it, and the long length of the pin posed a continuous and constant risk of injury to the bladder mucosa and urethral mucosa throughout the entire procedure. So the old treatment dictum is to use an open procedure for removal of large and long foreign bodies inside the urinary bladder. However, it is now clear to us that even long rigid foreign bodies can be successfully managed with the help of endoscopy provided we have adequate armamentarium with us. Thank you.